I'm Tamara, and this is TELUS Talks with Tamara Taggart. We're bringing together experts, thinkers, and leaders, busting myths, sharing stories, and staying connected when Canadians need it the most. We're having unexpected conversations for unprecedented times. Hi, Dr. Zainadine. How are you?
Hi, Tamara. How are you?
I'm good. I'm used to calling you Miriam or Dr. Z. What do you prefer?
I think we should go with what you prefer.
Miriam's
just fine.
Okay, well, listen, Dr. Z. You are a real advocate for self-care, preventative health. You are such a strong woman that has been very vocal about how we should look after ourselves and really zeroing in on things that many of us don't think about because we're so busy and we're so busy looking after other people that we kind of forget about ourselves sometimes. So can you tell us a little bit about your philosophy when it comes to healthcare?
Yeah, I mean, you may not know the story, but I've been a family doctor now for over 15 years. And after about 15 years of sort of practicing in this kind of healthcare system where it's very much of a Band-Aid approach, you know, you come in, you give us your symptoms, and then we're trying to kind of go through all the physical elements before we even go to the mental elements. So we actually divide the mental health and physical health right away as physicians. And that's how we were taught. And I recognize how much of a Band-Aid medicine this approach is. And I wasn't doing anything about it until it, you know, as a woman, it hit me hard personally. So all of a sudden, the things that become purposeful for you, it almost requires a little bit of that personal to get you to move to the next direction. Because I already knew it was Band-Aid medicine, but I kept practicing it. I kept doing it. And then I realized all the women that I'm seeing, especially the women that I'm seeing, you know, carrying all these, they're trying to juggle so many things at the same time, being a mother, being a full-time working mom or non-working mom, doesn't matter. In general, we are health, you know, we're care providers as women. So you know, to kind of put that ball in front of you and say, okay, well, if you're going to care for others, how are you going to care for yourself? And I didn't even really have the answers myself. All I thought about when it came to prevention was, oh, okay, well, I got to exercise and I'm going to eat healthy. That's all I thought about. And yeah, sure, exercise, physical activity has a huge scientific evidence behind how it actually impacts your mental and physical health. But there's so much more to it. So we started a not-for-profit organization called Zealy Care. And we basically put the acronym CARE, C-A-R-E, as a formula to give back to our patients, to give back to myself, actually, selfishly to myself.
Well, sometimes we need it. It starts with where, you know, when something happens to you, a light switches on and you see it from a different perspective. So what does CARE stand for?
So CARE stands for, the C stands for calming your mind. And calming your mind can be done in numerous ways, but what the C really signifies is a form of either formal meditation or an informal way of meditating. And now, Tamara, how do you calm your mind? Tell me.
I don't know if I do a very good job at ever calming my mind. I'll be honest with you.
So that's what everybody thinks. Everybody has this judgment around calming your mind. So, you know, and everyone's like, I can't calm my mind. So it's a write-off right away. But if we were to look at it as a mental exercise, really, you're not here to say if you do a good job or you do a bad job. we're not here for judgment. We're here. It's like going to the gym for your physical exercise. I mean, when you go to the gym and you exercise for, let's say, a week, do you expect to become this amazing athlete right away, or right away
Yes.
you're going to be? No.
Yes, I'm just joking.
But it takes more than a couple of weeks or even a month to actually see any form of results.
Mm-hmm.
So when it comes to calming your mind, I say, let's put away the judgment. Mm-hmm. And let's find a way where you can do some form of mental exercise. So be it a guided meditation, be it going for a walk and just paying attention to your senses, just so easy. Like we can do, I had a physician teach me the 5, 4, 3, 2, 1 rule, where he was like, what are the 5 things you see? What are the 4 things you hear? What are the 3 things you feel on your body? What are the 2 things you can smell? And what is the 1 thing you can taste? And I do that actually with my kids. Walking on the hike, I'm like, okay, what are the 10 things you see? And then they pay attention to all the things you see. What are the things you hear? All of a sudden, the minute you tap into your senses, your mind is not wandering to 500 different places. Your mind is actually here. It's present. It's where it should be. The problem with all of our minds is that our mind is either looking forward. It's always looking to the future. Mm-hmm. That's where your anxiety will come from, because you're always thinking about what if, especially now with the COVID times. All we're thinking about is, okay, what's going to happen next? Like, how long are my kids going to be out of school? How long is this going to happen? And it just goes to the future. Or your mind is in the past. It's always thinking about the past. It's always thinking about past stories, what's happened. This is kind of a very easy way to say it's just a form of the way our minds are wired. But so the C is calming the mind, and you can just do it as an exercise. And even if your mind stops wandering for 2 seconds, that's great. Because in a week, you keep doing it, your mind will kind of stop wandering maybe for 10 seconds. And then it will go on. So I'll be honest with you, Tamara, I've been doing it now I've been sort of formally meditating every day for about 10 to 15 minutes in the last 2 years. And I didn't see any difference the first few months. It's not like it's going to make you feel any better. It's not going to it just makes you very aware. It makes you aware of your reactions, your body, where you hold your tension. It gives you so much information of that self-awareness that we are all lagging. Because the more self-awareness you have, the better you can pivot, right? Just even knowing your feelings and your emotions, and knowing, what is it that you're feeling right now? Like nobody ever taught me any of these things before.
Yeah, same.
Right?
Same. And I think
we just plow through.
Well, we do plow through, because that's kind of the way the world seems to work right now, where we have, our computer in our hand, our phone, and we're always looking at it. We're always busy. There's somebody that always needs something. And even the idea, Miriam, of going for a walk seems like a waste of time sometimes.
Yeah, totally. Right. Because it just seems like there's no purpose. Benefit. There's no purpose. Yes. Like, I'm not activating my body. Like, what am I doing right now? But know that even if you spend 10 minutes a day sitting, and just the idea of calming your mind is not necessarily to calm your mind in a way. Actually, it's not quite intuitive, because you're just observing your mind without attaching emotions to it. So right. the way you have to see it is you're kind of seeing the clouds just kind of go by, rather than going chasing every single cloud. So what happens to us is a thought comes in our mind, and we go, oh yeah, I got to do that, and then it goes to the next, and then it goes to the next, and it just, we can't just be like, oh, that was just a thought, next and next. We just, it's a hard thing to do, because we're not wired. We're so wired to let our minds take over. Mm-hmm. And the more awareness we have, the more we can really tap into our essence, who we really are.
So what does the A stand for?
So the A is an easy one. It's activating your body. So physical activity, anything you can do for 30 minutes, 3 times a week. I mean, there's ample of evidence around that. There was a big evidence that they had a study with about 150 people, and they basically said for 10 weeks, if you can exercise 3 times a week for 30 minutes, and then, for 16 weeks, you do that. And then 10 weeks after that, we're going to see what your measure of happiness is. And for another control group, they gave them the antidepressant Zoloft. And for another group, they gave Zoloft and exercise. And what they found was the only cohort that actually was able to sustain their happiness measures was the exercise group.
Isn't that interesting?
90% of that group sustained their happiness, actually even more so than the Zoloft and the exercise group together. And the Zoloft group itself had only increased it by 50%.
Wow.
So
okay, what about the R?
The R is reinforcing your body, and that really is a full. There's lots of stuff in the R, but one of the big ones is in the reinforcing your body is obviously your diet. You know, you want to kind of make sure that you have a healthy diet, and I can go into the diet portion, but I'm not a dietitian, and one of the big dietary things I talk about is really if you can focus on some form of a Mediterranean or a plant-based diet, and you're sticking to your regular sort of regimented, healthy diet exercises, that's fine. But within that reinforcing your body, it includes your health screening. So really paying attention to what are the things you can prevent and what are the things you can go to your physician to get to be on top of your mammograms, your pap smears, your colon cancer screening, and those are all very difficult to know what you're supposed to do at what age. And I highly recommend you go and actually seek that information, including your immunization. I mean, now we're looking for, the COVID vaccine. That's the one big thing we're all looking for, right? To go back to normal. Your immunizations being up to date. And the last but not least in the R is your sleep. So really having a good sleep hygiene. And a lot of my patients at this time are really feeling that insomnia because their mind's just wandering and wandering.
Well, that's just it. I haven't talked to anybody that isn't, everybody's sleeping poorly right now. I'm an excellent sleeper. I've never had a problem sleeping my entire life. And I'll tell you, I am having trouble these days. I really am. And I'm not alone. I know that. So sleep is hard right now.
So then recognizing that the CAREs will work for that sleep for you. So if you can get up in the morning and you recognize your stress hormones are going to be the highest in the morning, actually. So the first thing when you wake up, your cortisol levels, which is your stress hormone, are going to be sky high. And actually, sometimes when you wake up, you'll notice your body is almost vibrating, like you're like, woo, and it's almost like you've already had your coffee, but you're so tired, you need to go get your coffee again. The idea is to lower your cortisol levels right away. So the only fast way to actually lowering your cortisol level is to go outside and, do some form of exercise on front of your phone, or go for a walk. And that itself will regenerate your serotonin and dopamine levels, which are what's needed for you to problem solve and stay calm and give you that sort of joy for the little things in your life. And I would say meditate first thing in the morning. And then, at night, what happens at night is you're almost that wiring that's been happening throughout the day and your cortisol's gone up and up and up. It just can't go up as high. You notice how then your sleep then becomes, and really try to take away all your screens for about an hour before you go to sleep, because we tend to check the news all the time. Like this is the problem right now. Right now is like we need to be on top of everything. We need to know what's going on. But I highly urge you to really step away from the screen about an hour before and create a good sleep routine for yourself, so that your brain has the ability to not bring all that information that you've put in it come out in sort of this unconscious lack of sleep way.
Yeah. Okay. And then let's not forget about the E in care.
So the E is the most important part, which is called engaging your soul. So engaging your soul means you have to know what your soul really requires. Right now, our soul requires that social connection. We are so socially isolated and distant from our loved ones. It's the pain of not having, we're such social creatures that it's difficult. So I say, if you know that your soul requires social connection, make an effort, even if you want to socially isolate yourself and not call your friends and you have nothing good to say, connect with them, connect with whoever you can. Even when you're going for a walk, connect with your neighbor in a socially distanced way. That's just a social connection of engaging your soul. But, right now, what you're doing, Tamara, the fact that you have a podcast and you're talking about big conversation, you're doing something bigger than yourself. Really, there's purpose, there's meaning. And I think at this time, we're always trying to find meaning. Every single human being wants to do something good for somebody during these uncertain times. So if you can sort of go outside of yourself and contribute to your community, that will feed your soul.
Yeah.
But to feed your soul, you need to have compassion for yourself. And compassion really just means, compati means to suffer with. You have to give yourself, you have to allow yourself to feel what you're feeling.
Right.
And
that's hard. That's hard sometimes.
That's really hard. That's very difficult because we're like, well, if we feel, then we're going to feel pain. And if we feel pain, then we're not going to be able to serve others. And then what does that make us? We're just not good enough, right? It just goes down to our core belief of just not being worthy enough, not being good enough. So I highly urge you to sit for about 5 minutes a day. That's a lot of sitting now. Now you got to meditate for 10 minutes. You got to sit another 5 minutes. But I sit for about 5 minutes and I think of that part of me who has fear. I think of her as a young child. I think of her as this young Tamara. And ask her the way you ask your own children. Ask her, what do you need? What do you need from me?
Oh boy. Yeah. This is interesting, Miriam, because you are a scientist, you are a physician, and it's not often that we hear scientists speak this way about our soul, about, meditating, about, reinforcing our body. But you've said some things there that I've actually tried to do and felt like I failed at it, like I think many people do. And so then we just walk away from it. Like, what good is meditating for 5 minutes going to be for me? But the way you just framed it think of it like going to the gym.
Yeah.
And, exactly. You're not going to be able to lift those big weights on the first day, but you can work towards it as your goal. Yeah. And so that is realistic. That is something that, this idea that it's okay if you go to sit down to meditate and you only do it for 1 minute.
Yeah, exactly. Okay. There's no right or wrong, even timing. I've tried to look up the evidence around what is the amazing time where you need to meditate every day. And, I haven't actually found the exact time. And especially we're in such a time-based society. Everything's so time-oriented that it sometimes actually bothers me. It gives me even more anxiety thinking about time. Now, when you go to, let's say, a forest, and you're just paying attention to your senses, you're paying attention to every detail of this forest that's so alive, that's a form of meditation, really. Right. And they call it forest bathing. And it has scientific evidence that it's beneficial for your mental and physical health to be in nature.
So let's think about if somebody lives in an apartment and they don't have access to a forest, they don't have access to, they maybe can't go outside. Maybe it would be opening the window
Yeah.
And
it doesn't have to be. Yeah, it doesn't have to be the forest. Yeah, exactly. Right. It doesn't have to be the forest. It could be, you can have a plant outside. You can actually see even in the most industrial city, there are trees planted at times. You can just go and hold that tree and you'll feel the aliveness of the tree. You can you can open the window, and when that wind hits your face, that itself is the fact that you're paying attention to your senses itself is a huge, huge element of how your mind is not wandering. Actually, one of the problems with women is that we're huge multitaskers. I mean, we are so good at multitasking, which is basically the toxin when it comes to calming your mind. So I am actively trying not to multitask. I do one thing, I try to finish it, and then I go and do the other thing. But then I'm like, but I have so many other things I have to do, and I don't know what to do. Yeah. So, and I say, no, you know what? If I learn to do one task at a time, that itself is a benefit for my health.
100%. Okay, a couple more things I want to talk to you about, because there's a lot to talk about with you. Fear and grief. There's a lot of that right now. We are in a worldwide pandemic. We have emotions from watching the news, hearing about deaths around the world, deaths in our own country. We are worrying, we are scared, and it feels like we are on this roller coaster of fear and grief. How do we get through this? How do we do this? How do we deal with this fear and grief that we can't seem to control?
Yeah. So the number one thing with any form of grief, and grief doesn't necessarily have to mean that somebody's actually died. It could be a loss of a relationship. It could be loss of your job. It could be the loss of your circumstances at the moment. That itself is a form of grief. Number one thing is grief is a roller coaster of emotions. So you can't say, I have fear, but I don't have sadness, so I'm not grieving. Or I'm just angry. Is that grief? Yes, these are all elements of the various emotions of what grief is. Now, emotions, if you let emotions, let's say you have an emotion of fear right now. If you don't attach a story to that emotion, it will leave you in a few minutes, because emotions are quite fluid. So it will just, you just feel it, you sit with it for 3-4 minutes, and all of a sudden you actually feel a little bit better and life goes on. But the problem is that all the emotions that we're feeling, they have memories. So the grief that we're all feeling, that the fear that we're all feeling, and especially it's the combination of fear and sadness, they have memories. It brings me all the way back to my childhood when I was in Iran, and we were at war in the middle of Iran-Iraq war. And I remember going with my mom to the grocery store, and we had to line up exactly like today. And they would only give you that certain amount of eggs because there was a rationing of food items. And the minute I saw that, going to the grocery store, I felt like that inner child that I have within me, that part of me wanted to scream and cry and get super sad. And I had to honor that. I had to honor the fact that my fear and my sadness really brought me back to my childhood. Now, your fear and your grief may bring you back to something else. It may bring you back to 10 years ago. It may bring you back to the loss of your job. It may bring you back to your childhood. And that's why it's so interesting to know that these emotions, they they have memory. Now, we have to acknowledge the emotions. We have to accept the emotions. We have to honor the emotions, but we can question the perception around it. And we can question the core belief around it.
Right.
And that's what we don't do. So we have to sit with the emotion and say, yes, I know fear. I know you're here. I know you're here to protect me because that's how you protected me when I was younger. That was a coping mechanism. But I'm okay. I am safe. I am doing my best. What is it that you need from me? And actually, when I talk to myself and I say, what do you need from me? A lot of times the word just freedom comes to my mind. I just need to be free because I carry so many roles and I carry so many responsibility. So I honor that and I go outside and I have my moment of freedom.
I see you do that. I see you do it on your Instagram, and now I know why you are always outside in the forest. It seems,
yes,
or for just a walk, right? And that makes sense to me because even you just sharing that story here, it made me feel fear for you. I all of a sudden was taking on this, this sadness for you. And you're right. We all have some form of that, and we may not even recognize it. When we talk about being preventative, or preventative health in the medical field. And we have these, we're not taught to be preventative because, listen, when I go to see my GP, I know she has 10 minutes for me, and it always goes longer than 10 minutes. And so then she's late and everybody's angry and everybody's this and everybody's that. And it's like, we're all trying our best. So, when you look at your data, when you look at the studies, when you were doing this in your practice, do you see this as a way forward for all of us? Preventative health.
100%. And, even if it's not going to be in every single doctor's office giving you this care formula, you can take ownership of that yourself. Now, the care formula is going to be more and more used in your regular, sorry, I lost you there. In your regular GP environment. If it's not your GP, it's your other healthcare provider, whoever it is, your healthcare provider. But ultimately, I think it's really up to us as human beings, as patients, to own our own health. We can't rely on an external healthcare system to teach us those things or advocate for those things. Yes, your family doctor is going to advocate for you if you do get sick, and they're going to be there for you 100% of the way with continuity of care. And I think that's what the beauty of primary care medicine is about. That's why I love being a family doctor. But ultimately, the system is a complicated system. We still need to have enough family doctors for, the 400,000 individuals that still don't have a family doctor. So I say we take ownership ourselves, and I say we do it with such grace and compassion and self-awareness. And really, we need to care for ourselves before we can even think about caring for other people.
Right. I agree with you 100%. I tell people all the time that you have to be your own advocate. And if you cannot be your own advocate, you have to find somebody who can advocate for you.
100%.
Because it's not easy to advocate for yourself always, So as we're wrapping up here, Miriam, your clinic right now, I know you're a very popular doctor, and anybody listening can see why, because you're so fantastic. But are you seeing your patients in person now? Are you seeing them virtually? How is that working for you?
No, we're seeing most of our patients virtually. In fact, we're only seeing patients that really need an examination. Let's say we're worried about sending them to hospital, or they need prenatal care, like the things that are really essential. We're seeing them currently because we have to really be cautious with our personal protective gear, and we don't have actually enough personal protective gear to see every patient. And it's bringing some convenience for our patients. Actually, they love the virtual care component. But, there are times where we do need to examine our patients. So most of our patients are seen virtually. And we're actually putting a pilot project together on seeing patients, specifically my patients with mental health concerns. So we have a proper follow-up, because a lot of people just don't call us and we don't know how they're doing, because they're like, she's dealing with COVID patients. And I want to urge people, don't worry about the COVID patients. If you need to be seen, if you're concerned, if you need to have a follow-up with your physician, call them. They would love to hear from you. Don't think you're burdening the system. In fact, the system will be burdened in the next 4 months if we don't care for all our patients.
Okay. And as we wrap up, Miriam, if we remember only one piece of self-care advice, only one thing, what would it be?
I would highly recommend you, if it's the one thing you do, is to sit in a quiet space, in a space that you enjoy, that you love. Sit for 5 minutes and take 2 deep breaths. Close your eyes. Pay attention to your body. Pay attention to where the tension is in your body. Attach an emotion to it. Sit with that emotion and ask that part of you, what is it needs from you? And then be grateful for what you have, the breath you have, and recognize that those feelings and those emotions will start dissipating because you just acknowledged it.
Thank you so much for that. Thank you. You can find out more about Miriam and her health philosophies at zillicare.com. That is ZILI care.com. And be sure to join us here on TELUS Talks with Tamara Taggart every Tuesday and Thursday. Thanks, Miriam.
Thank you, Tamara.